Hello, everyone, and welcome to part one of our lecture on chapter 13, the assessment of personality. So, one thing to keep in mind as we are going through this lecture is that we're really focusing on the psychology definition of personality, which is looking at the different ways that our attitudes, beliefs, and behaviors are this consistent component of our daily existence. It's this consistent pattern of how we think, how we feel, how we behave. And this chapter is really trying to capture how we best measure that in the context of counseling. So, we will be talking about quite a few different assessments of personality, and I wanted to let you know that a lot of the assessments that we're going to talk about in this chapter do require they do require PhD level training courses, or at the very least they are Q level personality assessments. There are some that are a little bit more flexible, but a lot of them are those Q level personality assessments. So let's go ahead and get started. So, personality assessments tend to be categorized as either structured or unstructured. And those structured assessments are oftentimes also called objective assessments. And the unstructured assessments are oftentimes also called projective assessments. And the key distinction here is that structured assessments are typically more standardized measures that have forced choice formats. So the questions that are being proposed have a very limited number of answer options, and you have to choose one of those. There isn't an option of describe other and then an open form question. And because they are forced choice, these standardized assessments tend to have reliability and validity scores. Where unstructured assessments are typically those that seek responses to some ambiguous item or tasks that will showcase personality traits or states. And that idea of being able to sort of project your personality onto this ambiguous stimuli is oftentimes called the projective hypothesis. And we'll talk a little bit more about what that looks like. But I want to break down this first half of our lecture on the objective structured personality assessments because they tend to be constructed using one of four methods. The first of those is the logical content method, which involves the test developer for a personality assessment identifying items that correspond with the apparent domain or content of the characteristic being assessed. So, in other words, the logical content is, oh, well, these items logically seem to be measuring this aspect of personality. Because it logically seems to be measuring that, I will put those in my assessment of personality. Logically, they seem to fit together. We also have the theoretical approach or theoretical method to personality assessment, which involves developing items that are aligned with some underlying construct. So you have some theoretical construct that you are measuring, and research supports that these components are part of that theory. So then you create questions that will address those theoretical concepts related to the overall construct of personality that you're trying to measure. We also have the criterion group method, which refers to developing items that relate well to a group of individuals known to possess a particular characteristic. Then the criterion group is compared to a control group on those same items, and the items that distinguish the groups well are retained. So this criterion group approach is really about saying okay, I have this concept of personality that I'm interested in. I know that this sample of people or this population score is said to have this personality trait. So a good example of this might be, there's actually a historical study of this that says that people who are monks are genuinely pretty happy people. So the way that a criterion group approach would say is okay, if I'm trying to measure the trait levels of happiness, I am going to test it in a group of individuals who are monks, and I am going to ask them about the characteristics that are true to them. And after I have interviewed that group of monks, I'm going to also interview a control group of people who are not monks. And I'm going to see what characteristics stay true. And any of the characteristics, any of the criteria that will specifically distinguish monk from non-monk are then retained because we say that they are distinguishing these two groups on the trait of happiness. And that's the criterion group approach. We also have the factor analytic approach, which involves a test developer using the statistical procedure of factor analysis to review the shared variance among items to try to detect the latent constructs or factors that make up that characteristic of personality. So, in layman's terms, factor analysis is this really cool and really fancy statistical analysis program where you start with a really long list of questions on a particular assessment. You probably develop those questions with subject matter experts and other people who have said that these are important characteristics to measure whatever construct of personality you're interested in. And you give that test to as many people as you can. And after everyone takes it, you take all of the data and you run it through this factor analysis model. And what the factor analysis model is going to tell you is which items on your assessment are intercorrelated with one another. When you have variables or questions that are intercorrelated, they combine together to become this factor, which is considered one component of the personality construct that you're measuring. And anytime that you get these intercorrelations of items, you group all those items together and they become one like subscale of that test. And however many factors you end up with is whatever subscale number you have. And any items that don't map onto any of the factors get dropped from the assessment. The most famous example of the factor analytic model is the Big Five personality inventory, which is assessing conscientiousness, agreeableness, neuroticism, extroversion, and openness to experience. That particular assessment was founded through the factor analytic model, and that's how we ended up with the big five factors that we did. So as you can see from this breakdown of the 4 different ways that we can construct objective assessments, there are 2 that sort of stand out as being a little bit more data driven. And those are the criterion group and the factor analytic approaches. A lot of times we actually consider those to be the empirical approaches because they are data driven and there's data to support why we include the items that we do. So now that we've discussed sort of how we've developed personality assessments, especially in the context of objective assessments, I want to go into a little bit more detail on some of the most popular structured and objective personality assessments. One of the most famous is the Minnesota Multiphasic Personality Inventories, or the MMPIs. And the 2 assessment inventories that are clustered as the MMPI inventories were each restructured recently. So the most famous of those is the MMPI-2, so the second version of the Minnesota Multiphasic Personality Inventory, and then its restructured form, which is the shorter version of the original MMPI-2. But we also have the MMPI-A, which is specifically for adolescents. We have a shortened version of that, the MMPI-A restructured form. That is all about that shortened version. And I'll talk a little bit more about these in detail here, but overall, the MMPI is used to evaluate individuals for mental disorders and to aid counselors and other helping professionals in treatment planning. And the way that you do that is by mapping individuals on these various scales or these various components of personality within the inventory. And there are these specific cutoff points so that if anyone's score is between 60 and 65, their T-score is between 60 and 65, it indicates that they could possibly have a psychological problem in that area. And anything that's above 65 is considered clinically significant. They're experiencing clinically significant distress in that area. So the MMPI-2 specifically contains 10 scales that are specifically designed to help differentiate people within particular psychiatric diagnostic categories. Those specific scales include hypochondriasis, which is the scale that measures symptoms of preoccupation with the body as well as a fear of illness or disease. There's a scale of depression, a scale of hysteria, which within the MMPI is the dysfunctional reactions to stressful situations. There's also a scale of psychopathic deviance, which is really looking at symptoms of psychopathy such as excessive drinking, lying, stealing, and sexual promiscuity. There's also a scale of what is called in the MMPI masculinity, femininity. And the MMPI proposes that this scale measures symptoms of quote unquote sexual inversion, or the lack of presence of traditional gender norms for each respective sex. I will say that although this scale is in the MMPI, it is the one that, if you're a clinician, is dropped from your analyses. You don't pay attention to it. You don't even list it in your output for clients, because it is a terrible scale within the MMPI, because what it's looking at is, do you adhere to traditional gender binary norms? And it is extremely reductive in that regard. So a lot of clinicians will drop this scale when they're interpreting the results of the MMPI. There is also a scale for paranoia as well as sacchisthenia, which is the symptoms that are associated with obsessive compulsive disorder. There is also a scale of schizophrenia as well as hypomania, and a social introversion scale. And there's also a set of validity scales that are used within the MMPI that are available to detect response sets for different test takers. And really what this looks at is whether or not someone is being truthful in their responses on the MMPI. In addition to sort of those validity scales and the 10 primary scales, there are also supplementary scales or content scales around anxiety, repression, and ego strength that can be helpful when you're interpreting the results. And it's important to keep in mind that in addition to reviewing the high and low scores on the clinical scales, counselors need to attend to particular items that would indicate imminent risk or harm to self or others, because those are included within the MMPI. And research indicates that the MMPI-2 scales, although they can be helpful for diagnosis, should not be used as the only diagnostic tool for classifying individuals into psychiatric categories, because it's not accurate in its ability to do that. Instead, the scales of the MMPI are most useful in providing descriptions of personality and as a source of inference regarding a person's behavior. I think it's also important to recognize that the original MMPI was normed on a sample of individuals in psychiatric hospitals, which is why we see the labels that we do for the MMPI. And as I mentioned already, the MMPI-2 restructured form, or the MMPI-2-RF, is a shorter version of the MMPI-2. The original MMPI-2 takes about an hour to complete for participants. We have the MMPI-A, which is specific for adolescents and between the ages of 14 and 18, and it is the most frequently used personality assessment for adolescents, as well as its briefer version, the MMPI-ARF. And in 2020, we actually had the MMPI-3 come out, and I will say that although it's out, it's still being moved into mainstream use. And one of the great things about the MMPI-3 is that its inventory was normed on various samples. So they have different norming characteristics or criteria for English-speaking individuals and for Spanish-speaking individuals. And the MMPI-3 also includes scales that measure eating concerns, compulsivity, as well as impulsivity and self-importance. And because the original MMPI-2 takes about an hour to complete, the MMPI-3 is supposed to be shortened, and it's estimated that people will take between 25 and 50 minutes to complete, which is pretty cool if you're looking at time components for your participants. And we also have the Millon clinical inventories, which are specifically used for normal to clinical levels of personality. And you can see here that there's a breakdown of a lot of these. The first of these, the Millon Clinical Multi-Axel Inventory 4, and its version for adolescents, the Millon Adolescent Clinical Inventory, both conceptualize personality on 3 levels: normal or adaptive functioning, abnormal or moderately maladaptive, and then clinical. And the former of those contains 15 personality disorder scales and 10 clinical syndrome scales, and the latter contains 27 and 3 clinical relevant scales. And then the Millin Index of Personality Styles Revised is a personality inventory that's designed to evaluate normal adult personality, and it contains 24 scales and 4 validity indices to provide information on 3 dimensions of normal personality. And those include motivating styles, thinking styles, and behaving styles. And the Millin assessments typically take around 25 to 30 minutes to complete and are really advantageous as clinicians and as participants because the results of the Millin closely tie to the DSM-5 so that psychiatric classifications can be made a little bit more easily when you take the Millin as opposed to the MMPI. We also have the Personality Assessment Inventory, or the PAI, which is a tool that's used for adults ages 18 and older. And it contains 22 scales clustered on one of 4 scale types. So there are validity scales, there are clinical scales, treatment scales, and then there are interpersonal scales. And the clinical scales of the PAI parallel many of the MMPI scales and can be characterized as neurotic spectrum, psychotic spectrum, and behavior disorder scales. So the treatment scales provide clinically relevant information related to interpersonal functioning specifically. And the PAI, I think, is interesting because it was normed on a sample of community dwelling individuals, which makes it more applicable to wider ranges of people when you look at its parallel to the MMPI, where the MMPI was normed on individuals in psychiatric care. The PAI was normed on community dwelling individuals, so it's a little bit more applicable around those interpersonal styles that you see in day-to-day. There are other personality assessment inventory scales that do exist, such as the Personality Assessment Inventory Adolescent, the Personality Assessment Inventory European Spanish with norms, and the Personality Assessment Screener, which are all useful depending on the setting for the client. We also have the Myers-Briggs Type Indicator, or the MBTI, which is a measure of normal personality characteristics that use 8 scales on 4 pairs or dimensions. So there are 4 different bipolar scales or dimensions that are each compared to one another. And these 4 scales are based on Carl Jung's theory of thinking. And the first dimension of the Myers-Briggs is extroversion versus introversion, or E versus I, which relates to an individual's preference for where they draw or focus energy. So in other words, do they move towards people, or do they move towards the outer world? Do they move towards people or the outer world, or do they move internally and toward their own inner world? The second dimension is sensing versus intuition, or S versus N. And this refers to how individuals perceive information. Do they perceive information through their 5 senses, or do they prefer to perceive information through indirect perception? The third dimension is thinking versus feeling, or T versus F, and relates to how individuals judge obtained data. And the fourth dimension is judging versus perceiving, or J versus P, which relates to how individuals opt to interact with the outside world and implement decision making. So a person's their Myers-Briggs Type Indicator personality type is summarized in a 4-letter code that indicates the direction of a person's preference on the 4 different dimensions. So you'll end up with a code that's similar to INTJ. And that means that you are introverted, use intuition, you like to think, and you are a judging person in terms of how you operate. And that's your code, is I'm an INTJ, or I'm an ENTJ, or whatever it is. And the direction or the code that is listed tells you where you fall on each of those dimensions on each of these scales. And all of the possible combinations for the 4 paired scales result in 16 different personality types. I do find it interesting because the way that the Myers-Briggs is sort of organized is that each participant who takes the Myers-Briggs is given a series of questions, And each question has two answer options. And it says, I would prefer, and then you choose between two options. And there's no middle option, there's no neither, there's no other. You are forced to choose between those two. And based on those differences, that's where you get aimed into one dimension versus the other, which means that the test retest reliability of the Myers-Briggs is actually incredibly low, because how you answer questions on day one versus how you answer questions even 2 weeks later can be vastly different depending on how you're feeling, what's been going on in your world. And that also then decreases the construct validity of the Myers-Briggs, in that it really doesn't measure the aspects of personality consistently like we want it to, because remember that personality is this stable component of how we think, how we feel, and how we behave. And if our scores are changing, then it's obviously not capturing personality. So there is some utility to the Myers-Briggs, but the reliability and validity of this assessment is not that great. And I think it's important to keep that in mind if you're thinking about using the Myers-Briggs, even for yourself. And we also have an alternative form of the Myers-Briggs, which is the Kersey Temperament Sorter 2, which has items and dimensions similar to the Myers-Briggs. In addition to getting a Myers-Briggs score on the Kersey, you're also given a temperament, and your temperament can fall within one of 4 categories. You can be described as a guardian, as an artisan, as an idealist, or as a rationalist. And we also have the California Psychological Inventory, or the CPI 434, and its shorter version, the CPI 260, which relates to how many questions are in each of these assessments. And both versions of the CPI assess an individual's positive and everyday personality attributes. It's often referred to as its folk concepts, because it's these things that show up in our daily life. They're considered just natural. And the scales within the CPI include things like scales on dominance, capacity for status, sociability, social presence, self-acceptance, independence, empathy, responsibility, well-being, self-control, good impression, conformance, and achievement. So as you can see, there's like this breakdown of these aspects of our daily life that are represented in the CPI. And these concepts or scales are then placed into an interpretive 3-dimensional model to help understand the information for the client. And it's important to keep in mind that the CPI items deal with typical behavior patterns and attitudes with less objectionable content compared to the MMPI. So the scales in the California Psychological Inventory are designed to assess positive personality characteristics. Like, people are very rarely upset at the scores that they get on the CPI, just because it's measuring aspects of existence and personality that are considered to be a little bit more positive. So it tends to get received a little bit better as compared to the MMPI. And because it's measuring these positive aspects of personality, and it's also been normed on quote unquote normal individuals, it has received the name in sort of pop culture within the assessment world as the MMPI for normals. And that's sort of the colloquial term for the CPI, because it does measure these aspects of positive personality. We also have the 16-factor personality questionnaire, which is sometimes just called the 16PF. And this contains 16 scales and 5 global factors on extroversion, anxiety, tough-mindedness, independence, and self-control. And the global factors are similar to the big 5 factors that we already highlighted, but then there are 2 additional versions of the 16-factor PF that are used for high school personality and children's personality. So it can be applicable across a wide range of client ages. And then we also have the NEO Personality Inventory Revised, which was explicitly designed to measure the big 5 personality factors of neuroticism, extroversion, openness, agreeableness, and conscientiousness. And there's a shortened version of the NEO that's just called the NEO 5-factor inventory. And this one is particularly helpful for just seeing where people fall on the big 5 factors. We also have the Cooper-Smith self-esteem inventories, which are oftentimes used to measure an individual's self-evaluations as they relate to social, academic, family, and other personal experiences. There are three forms of the Cooper-Smith self-esteem inventories, and those include the school form, the school short form, and the adult form. And it's important to keep in mind that the school form provides 6 scores on total self esteem as well as subscales related to peers, parents, school, and personal interests. And it has a lie scale to determine if people are lying on their responses. And overall, this particular inventory is really helpful for high school aged individuals as well as elementary school because it's normed on ages 8 to 15 on what someone's personality is in relation to their self esteem. Like, how is their self esteem being sort of displayed in their everyday lives? We also have the behavioral academic self esteem tool, which is a rating scale that can be used by teachers to triangulate self reported information about student performance that's reported on the Cooper Smith scales. So, oftentimes, the behavioral academic self esteem tool is used in conjunction with the Cooper Smith so that you give a child and maybe their parents the Cooper Smith form, and then you have the teacher complete the behavioral academic self esteem tool, and then you use them in comparison to one another to really get the most comprehensive view of a child's self esteem and how that's affecting their school and academic performance. And we also have the Tennessee Self Concept Scale, which includes 2 forms for ages 4 to 17, as well as ages 13 and over. And it's a popular measure of self concept. It breaks self concept down into 14 different scales. So it's really trying to capture what someone thinks about themselves. And then we have the Pierce Harris Children's Self Concept Scale, which is similar to the Tennessee and is specifically tailored towards individuals between grades 3 and 12. So as you can see, some of our structured personality assessments are really varied in what they're measuring, which is why we have such a wide variety of these assessments. So that's where we're going to end our first half of the lecture on chapter 13. Join me for the next part of the lecture where we're going to go into more detail on the unstructured personality assessments. I will see you all in the next lecture.